everybody. I'm Dr. Nina. I'm the founder of TOVA Community Health. TOVA's mission is to provide compassionate, holistic, comprehensive care to individuals living with sickle cell anemia and trait. I am back for another season of TOVA Tuesday, and TOVA Tuesday is on our TOVA Health TV platform on YouTube, so check us out. I bring on guests that are community leaders, practitioners, and healers to educate my viewing audience about ways to empower themselves to live their best life and build a sense of community. Today, I will not disappoint you. I'm always looking for guests, and especially those that serve our community and advocate for our community. And today I have Mrs. Tesha Samuels. Welcome to TOVA Tuesday, Mrs. Samuels. How are you today?
I am doing fantastic. Thank you for having me, Dr. Anderson.
Well, I want to send my greetings from North Carolina, and I'm excited to know that you will be joining us in person soon in September, which is Sickle Cell Awareness Month. But I'd like to just talk a little bit about you. I wanted to share a bio. All right. I want to let everybody know that Tesha is a sickle cell warrior, a phenomenal woman who is a daughter, a wife, a caregiver, and a friend. Her life took a transformative turn in 2018 when she became the recipient of an autologous gene therapy transplant at the NIH, which is the National Institute of Health. This procedure proved successful and miraculously put her in remission, cured of her sickle cell, and not plagued with the many symptoms that sickle cell warriors experience, including pain. Her lived experience with this life-changing therapy has sparked a profound passion to advocate and educate those suffering from sickle cell and other rare diseases. Thank you so much for coming to TOVA Tuesday today. I first want to start with just asking you, you were diagnosed with sickle cell at 2. So this was before the institution of the newborn screening program in the early 1990s. What was like for you?
So life after diagnosis, of course, was just a lot of just figuring out what's next. I was the daughter of a single mother, although my community involved my grandparents, my physicians, who, of course, wanted to try and help my mother and I navigate this new normal for us. But it was plagued with many sickle cell crises. I mean, from 2 to 7, I probably had so many colds that I could probably be a billionaire.
Oh.
If I had $5 for every cold or flu or pneumonia that I had. And so it was more about navigating that. Now, at the age of 7 is when I had my first major crisis, which was an aplastic anemia crisis, which nearly took my life because the doctors had misdiagnosed this as some other viral thing that was going on, because I started out with a high fever. I was becoming short of breath, and so they thought maybe it was pneumonia and tried to treat it with the typical antibiotics, which was penicillin at the time. I was on penicillin daily. At that time, that was pretty much the only treatment that we were able to receive. Beyond 7, again, it really started to take a toll on my life every single year. I think I have, in my 42 years now of living, the majority of my life in those big moments, whether it be birthdays, holidays, major family events, I was in the hospital. And so I was looking at life feeling as if I was an outsider. It was when I turned 13, I had a minor stroke, which then the part where, now I am taking a day out of my life to receive blood transfusions on a monthly basis. So every 3 to 4 weeks from the time I was 13 years old up until 36 is when I had the gene therapy transplant. I was tethered to getting, 2 to 3 units of blood per month. So that's really no life at all. Um, so much has just been packed into that. But then I think those preteen/teen years was difficult because you're trying to navigate all of the hormones that are going on. You're trying to be just that normal teenager. On the inside, I knew who Tesha was, but I just could not. I could not connect the internal with the external because there was so much going on with sickle cell that I just started to downgrade my dreams, my passions. Who am I really if this is what I'm limited to?
Wow. Can you tell me, like, in a year, how many times were you hospitalized? Like, what was the maximum number? What was the largest number of times you had to go to the hospital in a year for sickle cell flare up?
I would say the longest amount of time, well, I would say how many times the most was about 5 times a year. But you're talking about where each time you're in there for 3 weeks, 4 weeks at a time. The longest period of time that I was in the hospital was when I was 16 years of age, and I went through a chest crisis, which I had to be placed in medical induced coma, and then transferred over to the Kennedy Krieger Center, which is here in the Baltimore, Maryland area, for an additional 6 months. So I would say about 9 months of my life was
Oh my
spent in
goodness.
rehab. And that was at the
Wow.
16 into 17.
Wow. So did you have a stroke where you had to learn to walk again, learn how to use your arms, your legs?
Absolutely, Dr. Anderson. So that I didn't, at that point, I had not had a stroke, but I think that being on that medically induced coma for such an extended period of time, when I woke up, it was, how do I bathe myself? How do I walk? How do I, do a lot of the things that I knew that prior to I could do that I was relearning. And that
Wow.
and a huge part of my life because that was my senior year in high school. So, my goal was I am going to walk across the stage. And at that time, I was being pretty much told that you may be in a wheelchair for the rest of your life. So it was a huge wake up call for me. And my faith really just kept helped me to move forward in my community, my church community, my family who were praying for me that if this is what you want, then we are going to stand behind you. And so by prom and by having graduation, I was able to walk. So I thank God.
Wow. Well, that's because you're a trooper. I
Well,
want to
thank you.
ask
We
you,
are warriors. We are warriors,
yes.
right?
So tell me, okay, your experience in growing up with sickle cell, you missed a lot of activities, school events, maybe perhaps prom, and accessing specialty care or a team of doctors who had an interest in treating you with sickle cell. Can you talk about that?
Yeah. So I did have a hematologist, as I mentioned. One of the things that I feel that is missed by the medical community is really us having, as warriors, sickle cell warriors, having a sense that we have someone that has an interest truly in us. I know my experience, and I know things are changing now, but my experience as a sickle cell warrior going to the clinic was that we were always grouped with the oncology, and we always felt, well, I always felt like an outsider, that I am here just because they have no other place to put me. That my pain next compared to someone that has leukemia in the next curtain next to me or behind the next curtain, that in comparison, they were going to get the pain medicine first, or if they were nauseated, they were getting the medicine first. And then it was like, I'll get to you afterwards. And so that was my experience up until I had this gene therapy transplant. It's sad to say, now, granted, I had some wonderful and terrific nurses that took care of me inside and out of the hospital, and doctors included, but I never felt like I was a priority.
Wow. And I'm sure that there are other sickle cell warriors who have experienced that as well. And in honesty, I mean, you talk about the the resources and the monies that is spent on cancer research compared to sickle cell. There's no question of that. And so when you look at any hospital institution, they're going to probably put more of their resources towards the chronic conditions that generate the most revenue. And unfortunately, sickle cell falls beyond that. And as a healthcare provider and advocate, that's something that we are, as providers, are challenged with even to this day. So I thank you so much for sharing that. One of the areas of research and advocacy of mine is the transition from pediatric to adult care. And I wanted to know what your experience was like. How did your team of doctors bridge the gap of pediatric care to adult care? What was your experience like? I do remember one of my patients has told me that I was kicking him out, but he was 25 years of age. His mother came into the office screaming and yelling. We had to have a team meeting. He's 25 years old. He cannot stay at a pediatric hospital all of his life, though she would probably have liked that. But tell me about your experience.
Oh, wow. Well, now things are a little different. So back when I was making that transition, Pete stopped at 21 years old. So here I was trying to complete a semester at Howard University, and I go into a crisis, and I have my roommate trying to get me to the hospital. And Children's National is literally around the corridor from there. So I arrive at Children's National, like, here I am. I'm in a crisis, and I was promptly told, you're an adult. And so we need you to go to the Washington Hospital Center, which is, of course, right behind there. But being in that moment, I did feel like I was left in a wilderness and trying to figure out, now, how do I navigate this? As a warrior, it takes so much to build a relationship and a rapport with a physician that you feel listens to you and knows you, and the medications that you take, especially, with opioid medications really being, a sticking point for many. When you find that doctor that believes your pain and says that, I know that this is something that you can handle because your pain is this severe, and then having to start that process all over was quite an eye-opening and disappointing experience for me. It is my prayer that as more doctors, and physicians, healthcare teams become aware of this challenge of moving from pediatrics to adult care, that transition becomes a little smoother, that a come together, a board meeting, however you want to call it, and we need a meeting to talk about how this transition is going to, plan out. And I can understand that the parent also is advocating, because they too also know, like, I don't know if I can put my child's hand, who is now an adult, in someone else's hand, and I'm not sure how you're going to handle that, my child. And so that's now an adult. And so that's always something that I've been praying for, that we can really figure out what that looks like, a great transition from peds to adult care.
Thank you so much for that. So I want to say that for you, the types of treatments and disease modifying therapies that were used to control or to reduce sickle cell flare-ups was you were getting transfused every month for over 20 years to keep your sickle cell from flaring up. And even though, theoretically, say our goal is to push your hemoglobin S down to 30%. You were still having a lot of chronic pain. You still were needing to be hospitalized. Did you try any other of the newer medications that came out during that time, like hydroxyurea therapy?
I did try hydroxyurea several times. We increased it, as much as we could. And just unfortunately, hydroxyurea just did not work for me. But I have met warriors that it does work for. I'm excited about the new medications that have already been placed on the market to try and get that fetal hemoglobin to stay elevated. But yeah, hydroxyurea was pretty much, again, we're just in a new time for sickle cell. So I'm excited. I'm so excited for the
That is
options. We
exciting.
didn't have options. And so I'm excited about the options. But hydroxyurea was the option for me. It didn't quite work out. And then I also tried Jadanu and XJ because of the monthly transfusions. By the time I got to, let's see, I think I was maybe at 28 or between 28 and 30 that I started to have to use the pump or use those medications in order to get rid of the excess ferritin level.
So your iron levels were elevated because of the chronic transfusions. You couldn't get your pain under control. You wanted to live a quality of life. You want to finish college. All of these things are going to be hampered because of your sickle cell. I just want to also share with, and one of the things that just sticks out to me is you are a woman of faith. And one of the things that I read in one of the journals called NIH Medline Plus was that you view your miraculous recovery as a testimony that with God, seemingly all things impossible become possible. So I want to go back to, you've tried the chronic transfusion program, you've tried hydroxyurea, nothing is seen to help. When were you at your point where you said, I want to explore the possibility of curative gene therapy treatment?
Great question. Just for context, I knew that I just had the faith that something was going to happen for me. I can't explain it. I couldn't put it in words, but I just knew that I was tired and I was desperate. And I was like, Lord, there has to be something better in store for me. And I will never forget going to the doctor prior to my wedding day. And I was like, I am getting married. I finally found the man that's going to accept me for who I am, disease and all of the things that, you know, that come along with being an adult sickle cell warrior. And he's accepting of me. I want my eyes to just be as white as my dress. And my doctor looking at me with like, there's nothing that I can do. I can't do that for you. So that was a pivotal moment for me. But beyond that, when I really made the determination that let's see what's out there, I would check the NIH website every year. Please believe me, from 15 years old, I was checking the website every year to say, there has to be something. All of this research is going on. I know the cancer research is through the roof, so it has to be something. And it was, you know, I knew that the half match or haploid transplantation was being done, and it had worked for some sickle cell warriors. But I didn't have a sibling until I was 19 and 21 years old. So that wasn't an option. And then by the time I got to the desperation point, like something has to give, they were still small children pretty much to me, and I didn't want to put them through that. But when I went to the doctor, I was at a 3-month visit with my hematologist, and I had been on the therapy for getting my blood transfused every 3 to 4 weeks. And she looked at me and says, your iron level is so extremely high that we're concerned that you're going to now need dialysis. And, you know, we are on this amount of pain medication. There's not much we can do. And in that moment, it was like a light bulb went off. And I said, you know, she's a doctor, but I know the ultimate doctor. And I left that treatment center with tears in my eyes. Lord, there's nothing that they can do, but there's something that you can do. And I went home, I did my research, went on NIH, and lo and behold, I see this autologous gene therapy. And I was like, this is it, Lord. You didn't tell me how you were going to heal me, but I think this is it. And so I can't say full steam ahead because I had my mother and my husband to consider, but pretty much in my heart, I knew that this was his way of doing just what I asked.
Wow. And I want to say that um, you know, you did your homework. I mean, you were looking for treatment options, new treatment options, curative treatments out, searching the NIH, like all of the research that is being done there. So I want to take us to the point where you met with the transplant team at the NIH and they go over the risk from the procedures and the treatments, including taking busulfan, which is a chemo drug that could possibly cause a lot of different side effects and possibly death from this curative treatment. How did you say, all right, I'm going to proceed forward? I signed that consent form and said, I'm not turning back. I'm going forward. Can you talk about that?
Sure. So between the time that I found out about this therapy to the time I signed the paper was a year. The reason for that is I really wanted to first reconcile within myself that this is something that I'm ready for. B, how does the family that's been taking care of me, even though I'm an adult, I was still really being taken care of, especially in those lower moments and points. But having them to try and get buy-in. And by no means did I really get full buy-in at that point. But at that 1 year mark, I called Dr. Shea and I asked for him and his team to meet with me and my team. Who is my team? My immediate family. And when I tell you we had a boardroom full with notebooks in hand, tape recorders in hand,
Oh,
and wanting them to get into the details. And it was scarier, I think, for my family than it was for me, because at that point, when I signed on the dotted line, I said, if it does not work, that my journey would be for the benefit of journeyers and warriors behind me. And at that point, when I signed the paper, it was no longer about me. It transcended me. It was like, this is therapy that they have actually taken time because they care about sickle cell warriors. I had met the principal investigator and really gotten to talk with him, my mother and I, and saw the passion behind this. And I said, if it's not for me, it's for somebody else. What they learn out of my experience will benefit others behind me. And this, with that confidence, I signed the document.
wow. I want to say you're a woman of faith, but a woman of courage as well. And the fact that you knew the risk, but you were willing to proceed forward because what they could learn from that could help others behind you. And I want to say that you were the fourth person to enroll in the NIH gene therapy trial in the country. So that is quite an honor and something that I just want to, give my hats to you that you are so forward thinking and a visionary, I would say, that you have paved the way for other sickle cell warriors to come behind you. And the amount of information about your experience and all of the things that occurred during that time, all of these researchers will have learned from that and to modify the treatment to make it better for those coming along. And that you were able to say, all right, I'm going to take that leap of faith and still move forward with that. That's very commendable. And I want to thank you for that.
Thank you. Thank you.
So before we end, I also wanted to share with our viewing audience that there are some things that I always like to give tips. I call it TOVA tips to share with others about things that I come across and say, all right, I want to make sure people are aware about, the importance of doing your homework, the importance of making sure that you understand everything that's going to incur. But it seems like you built, besides doing your homework and your research, you built a team. You put a village of people around you to help you get through this journey. It was your hematologist. You also consulted with the transplant coordinator. You also had a principal investigator, Dr. Shea, that was following you through the process. But I also think it's important when I think about TOVA tips for those who are considering curative gene therapy treatment is that you still get your yearly wellness exams. You engage in self-care activities to keep yourself emotionally and mentally balanced, because I'm sure there were times where you probably experienced extreme anxiety and depression. So you needed to make sure that you had a good support around you, and perhaps may have needed to talk to someone or a therapist to help you get through these difficult times. But also, I see it in your experience as running a marathon. It's a journey, and there's going to be times where you're going to get a little tired, but you have to go forward. There may be times where things don't always go as planned, but you always keep your eyes on the prize for the end goal. So those are my TOVA tips. Did you have any others you would like to share?
I think you made great points, and these are fantastic tips. I would always, I don't like to sound like the doctors, but it's so true. Really drinking your water is a part of that
Um,
here. We get so tired, we feel like we are waterlogged, but when I tell you it does work, it helps not only internally, but externally, really keeping, those blood cells moving. Um, Running the marathon is so true. It's one of the reasons that I named my organization Journey to Excellence. And it's because our entire lives is a journey. We don't know what the next mile will bring, but we do our best and just keep journeying through it. Um, and I would say journaling, really, whether it's your transplant or gene therapy journey, or just your everyday sickle cell battles, it is so important to journal. I like to look back at journals that I've done when I was a teenager and in the hospital, and thinking that all is lost to some of my, highest peaks of, graduation, even though I didn't think I would walk across the stage. Things of that nature. When you're able to look back and see where you've come, it really helps, and it's a boost to your confidence. So those are some of my tips.
Thank you so much. And I also want to say that you are the co-founder of Journey to ExSCellence, which is a nonprofit organization that aims to provide advocacy and direct support for adult sickle cell warriors and their caregivers. Talk about that, starting a nonprofit.
Yeah, that in itself is a journey for sure. One of the things that really sparked an interest of my husband and I've been advocating since I was about 14 years old, just even about bedside manners. That's where it started, just providing tips and tricks to, physicians and caregivers about how to treat us when you come to our bedside. So that's where it really started for me. But my husband and my mother, who have been there with me as an adult, trying to strike it on my own, so to speak, and how that transition was so difficult, trying to navigate the workforce and medical care and so many things, and not having enough, making decisions like, do I pay my rent, or I know I have this expensive medication, things that people don't think about when they become, as they transition to adults. And sometimes it gets forgotten when we make that transition. And so we really wanted to link up with people in the community to try and address some of these needs, because he's been in that caregiver. My husband has been, and my mother have been in that caregiver seat, to try and provide for me when I couldn't. So just really providing that support. And so we're always looking to partner with businesses and organizations that can help and assist in doing that. So
Wow, thank you so much. I am so excited to uh, meet you in person in September, National Sickle Cell Awareness Month, as you come to Delaware. And we
yeah.
can hear more about your lived experience at our Transformative Curative Gene Therapy Transplant for Sickle Cell Anemia Educational Symposium, where we'll go more into detail about the gene therapy curative treatment, the process from beginning to the end, and what you're doing today. So I thank you so much for coming on TOVA Tuesday today. I also just wanted our viewing audience to find out more about you, how they can contact you, and also be able to get in touch with you because maybe you are a speaker and an advocate, and they may want to contact you. How can they do that?
Sure. The best and easiest way to get a hold of me is through my email address, which is tsamuels at
All
Journey
right.
to Excellence. And excellence is spelled with an SC for sickle
Mhm.
cell.org. Additionally, you can always reach us by our webpage to see what we're doing. Most recently, we've been donating to a local area hospital to their adult sickle cell clinic. But you can definitely find out what activities, events we have going on at www.journeytoexcellence.org.
Thank you so much, Ms. Samuels. And I also want to share that your personal story was highlighted on the NIH Medline Plus magazine, which is volume 18, issue 1. And the title of that personal story was Tesha Samuels Advocates for Others After Living with Sickle Cell Disease. So I encourage everyone to go there and read more about her story. It's just an amazing journey. And again, I just want to thank you so much for coming on TOVA Talk today. I've learned a lot, and I can't wait to learn even more about your journey, about the gene therapy, so that I can advocate for my clients as well, my patients, my warriors, so that they can take that leap of faith, move through the process for my goal to see a universal cure for sickle cell. I want to thank Mrs. Tesha Samuels for joining TOVA Health TV today on TOVA TV. To hear more about TOVA Community Health, please visit our website at www.tovacommunityhealth.org. You can also like us on Facebook and Instagram at TOVA Community Health. If you're interested in making a donation, please do so at our Cash App site at $TOVA Health or our PayPal link at contact@tovacommunityhealth.org. Thank you so much, Warrior, Mrs. Samuels, for joining us today. And again, I look forward to seeing you personally in Delaware in September, National Sickle Cell Awareness Month. Thank you so much for your time today.
Thank you for having me.